And these painful life experiences cause there to be very deep emotional wounds. So it's very, very important for us to be able to develop these skills so that we can first and foremost help ourselves and also help our loved ones or the people that we are close to, so that we can be able to solve these emotional issues. Now, the word psychology, and this is very important because psychology and counseling goes hand in hand. The word psychology simply means the study of the mind and the soul. The study of the mind and the soul. A psychologist is someone who has the ability to study the mind, the soul, and human behavior. Because all problems that we face in life, whether emotional, whether physical, whether financial, whether relational, they affect our mental wellness. So it's very important for you to understand that a psychologist is somebody who is able to help you deal with mental health issues, because psychology is a study of the mind, the soul, and human behavior. So the work of a counseling psychologist is to help people who are facing issues as well as mental health issues. The work of a counseling psychologist is someone to help people who are facing mental health issues as well as emotional issues. So also it's important for us to say that mental health refers to how people feel, behave, and think. Mental health refers to how people feel, behave, and think. When a mentally healthy person, again, is someone with the capacity to balance work, relationship, as well as the emotional well-being. So we need to put a distinction between a mentally healthy person and a mentally ill person. A mentally healthy person is someone who has the capacity to balance work, relationships, as well as their emotional well-being. This is someone who has very good coping mechanism. This is someone who is in control of his environment. Whereas a mentally ill person is someone who has lost control over his circumstances. A mentally ill person is someone who has very deep-rooted and unresolved emotional issues. Those issues can stem from childhood. When you've been through trauma, when you've been through traumatic experiences, then those can cause there to be emotional scars, and that can play out in your adult life. There are so many people in their adult life, they are still victims of what happened to them in the past. Maybe you are physically abused, emotionally abused, sexually abused, and what happened to you in the past is affecting you in your present day. So again, these are deep-rooted and unresolved emotional issues that lead to mental health issues. So someone who is mentally healthy is someone who has the capacity to balance work, relationship, as well as the emotional well-being. But someone who is mentally ill, someone who has psychological issues, is someone who has lost control over their environment. So the purpose of mental health awareness, again, is to let people who are struggling with mental illnesses know that they are not alone in their struggles, and that seeking help and seeking treatment makes a difference. That's the purpose of mental health awareness, to let people who are struggling with mental illnesses, and we're going to share a bit further in the program what these mental illnesses are. It is to let people who are struggling with mental illnesses know that they are not alone in their struggles, and that seeking help, seeking treatment does make a difference. So what is the official definition of a mental illness? Mental illness is a health problem that affects how a person feels, thinks, behaves, and interacts with other people. And I need you to understand that, because again, the root cause of all our psychological issues, the root cause of all our mental health issues has to do with our relationships with other people, has to do with our experiences, whether good or bad. It has to do with how we think about ourselves, because all of us are a product of our environment. You are a product of the experiences you've been through from the time that you were born. So mental health, or mental illness rather, is that health problem that affects you, how you feel, how you think, how you behave, and how you interact with other people. There are so many people who have a poor self-image, so many people who have a low self-esteem, not because there's anything wrong with them, but because they have been shaped by their experiences. When you grow up in an abusive home, when you grow up, in abandonment, maybe you are abandoned by your parents and you have faced rejection from the people who are supposed to care for you, all those experiences can affect your self-worth and affect your self-esteem. So when you have a grasp of these, it makes it easier for you to be able to analyze yourself, and basically you can even diagnose yourself to know what the root cause is. So some of the mental illnesses are what? Depression is one of the mental illnesses, which is very common. Depression, it is a mood disorder that causes persistent feelings of sadness and loss of interest. It is one of the most common mental illness, depression. It is a mood disorder caused by persistent feelings of sadness and loss of interest. So again, depression is in levels. You can have mild depression, acute depression, and severe depression. And it is in levels, it is in stages. And really what triggers depression for most cases is stress. Stress is one of the triggers of depression. And we say stress is mental strain. When you go through so much at the same time and your mind is not able to process it, then that can easily lead into depression. So again, we need to learn how to deal with stress, because life comes with stress. All of us face stress. The difference, or the question, is how do you cope with stress? If you don't have effective coping mechanisms, then that stress after a prolonged period of time can easily lead to depression, because depression is one of the most common forms of mental illnesses. So causes of depression, we said, of course, is stress. And also, when someone has been diagnosed with a terminal illness, can lead to depression, because when you're diagnosed with a terminal illness, you feel as if your life has come to an end. You feel as if there's nothing worth living for. So you enter into depression. There's no motivation to get up and continue with life. So we have to be careful, especially when we have loved ones who have been diagnosed with terminal illnesses. We have to affirm them and be there for them. We have to motivate them and encourage them and listen to them, because they can easily slip into depression. There's nothing as tragic as when someone has been diagnosed with an incurable disease. Maybe you've been diagnosed with cancer, you've been diagnosed, with sugar diabetes, you've been diagnosed, with any other condition that has no cure. It can easily lead to depression. Another cause of depression could be what? Loss of a job or loss of a loved one. When a husband loses his wife, when a wife loses her husband, when children lose their parents, the loss of a loved one can trigger depression. The loss of a loved one can trigger depression. So we have to be careful, especially when we have friends or relatives who have lost a loved ones. We need to be there for them. We have to be there for them and give them the emotional support, because if we neglect them, they can easily fall into depression, because they feel that no one can replace, the space their loved ones left. There's a vacuum and an emptiness on the inside of them that makes them slip into depression. Another cause of depression is what? I said loss of a job. When you are the primary sole breadwinner and you've been laid off in your workplace, or your business goes into receivership, when there's no income coming in, that can cause you to enter into depression, especially men, because men traditionally are the sole breadwinners. When they lack the ability to bring bread to the table, you find most of them can slip into depression. Why? Because men don't talk. If there's one thing that men do not do, we don't talk about our issues. So your husband could be coming home to you, he's looking okay, but on the inside he is depressed. And when that depression gets to a point, you realize they go and look for temporary relief in alcohol. There are so many men who are in alcohol abuse, not because they want to, but because it is a stress reliever. It is their way of overcoming depression. So if you have a loved one who has lost a job, a loss of income, it's very important for you to be their support system, Very important to be the support system and encourage them and affirm them. Why? Because they can easily slip into depression. We say depression is a mood disorder caused by persistent feelings of sadness. When someone is depressed, they have no zeal, no desire, no passion to continue living. And that's why we said even in the extreme circumstances, depression can lead to suicide. Yes, depression can lead to suicide. When someone has been diagnosed with a terminal illness, they feel the only way out is death. Why postpone the inevitable? I'm going to die anyway, so I might as well take my own life. When a man has lost his job, he feels he's no longer worth, because the identity of man is in our job. Our identity is connected to our work. So when we lose our work, we lose our identity. And when a man loses his identity, he feels he's not worth anything, and he can easily take his life. So it's very important for us to understand that, because there are so many people who don't want to talk about this issue, especially depression, because there's a lot of stigma around it. But depression can be a game changer. You need to be able to look out for the signs of depression. What are some of the signs of depression? Loss of interest, poor appetite, poor sleeping patterns, temperamental mood swings, anger. Someone can be withdrawn. And a classic sign of depression is when someone was not drinking and eventually they end up drinking. Then that is a trigger. That is a very classic sign of someone who is dealing with depression. Someone may be crying a lot. Someone, no longer wants to be around people. Why? Because depression makes them withdraw from the support system. So it's very important for us to be very careful, especially in these harsh economic times that we are facing. There are so many people who have lost the zeal for life. They could be in the stage whereby the depression is mild, but if not resolved, it can become acute. If not resolved, it can become severe. And if not resolved, it can lead to suicide. So depression is one of the most predominant forms of mental illness. Now, there's another mental illness known as social anxiety disorder. What is social anxiety disorder? This is fear of interacting with people. You are afraid of interacting with people because you are worried about how people perceive you. There are people who don't want to be around other people. Why? Because they feel they are being judged, they are being scrutinized. There are people who cannot stand in front of other people. There are people who cannot express themselves. There are people who have anxiety disorder, and especially young people, especially teenagers. You need to be careful, because teenagers are very self-conscious. They're conscious of how they look. They are conscious of how they talk. They are conscious of how people view them. And if you do not address these issues, it can easily lead to social anxiety disorder. A healthy person is someone who has the ability to express themselves. You should be able to stand in front of people and express yourself. You should be able to be comfortable in your own skin. You're not supposed to compare yourself with other people. You're supposed to know that you are adequate exactly the way you are. The Bible says that we are fearfully and wonderfully made. So social anxiety disorder is another classic example of mental illness. Another one is what? PTSD, post-traumatic stress disorder. This is very common, especially for people who have been through trauma. People who have witnessed something terrifying, someone who's been through an accident, a car accident, and they lived to, tell the tale. Someone who has been forcibly taken advantage of. Maybe someone was raped, or maybe someone experienced a robbery at gunpoint. That can lead to post-traumatic stress disorder. And some of the symptoms of PTSD is what? Sometimes you find you wake up in the middle of the night because you're having nightmares. You cannot sleep at night. You cannot sleep by yourself. You cannot sleep with the lights turned off because you are afraid. You cannot enter a car because you are afraid. You cannot be alone in the presence of strangers because you are afraid. Post-traumatic stress disorder is very common, especially for those people who have witnessed terrifying events. And they have symptoms such as nightmares, flashbacks, uncontrollable thoughts. They can sweat. I mean, they can go into shock at any moment. So people who have witnessed terrifying events, they need a lot of therapy. And that's why I'm teaching you on how to develop basic counseling skills, so that if you have a loved one or someone who's been through some of the things I'm sharing with you, you can offer them help. You can be of comfort to them. So PTSD, or post-traumatic stress disorder, is very common, especially for soldiers, people who've been through, who've gone to war, to battle, and they have seen death on a large scale. Most soldiers, when they come back from battle, they deal with post-traumatic stress disorder. For example, in our Kenyan context, when terrorists hit Westgate several years back, the people who lived to tell the tale, some of them even today cannot enter into a shopping mall because they are terrified. They have flashbacks of the ordeal they had to go through. So post-traumatic stress disorder is also a very common mental health illness. And then we have another one called personality disorder. Personality disorder is when you have patterns of thoughts and behaviors that are unhealthy. Mood swings, difficulty making friends, angry outbursts. You have a personality disorder. You cannot make friends and keep friends because you keep ruining them. Why? That's a personality disorder. You don't know how to make friends and sustain friendship. Why? Because you ruin those friendship by the things you say or the things that you do. So when we have this understanding, and I'm just mentioning just a few of these mental health issues, it's very important for you to understand that if you are able to develop these basic counseling skills, you can help your loved ones. You can help your loved ones, especially when you are able to identify some of the symptoms that I'm sharing with you. Another common form of mental illness is eating disorders, such as bulimia or anorexia. Anorexic people are people who obsess about weight gain. So what happens is this: the minute they eat, you find that they can starve themselves to death. People who have anorexia, they starve themselves to death because they are fearful of gaining weight. Some of them will go on extreme diet. They will miss meals, skip meals. Why? Because they don't want to add weight. It's anorexia. And then we have another one called bulimia. Bulimia as a eating disorder is when people eat excessively, and then after they eat excessively, they feel guilty, and then they induce vomiting. So this is very common, especially among young girls who have body identity issues, teenagers who have body identity issues. Maybe they feel they are not beautiful enough. Maybe they feel they do not look like their favorite celebrities. So they can develop anorexia or bulimia. So as parents, you have to be very vigilant and make sure that you are watching your teenagers very closely. Make sure they have a healthy eating pattern and encourage them, affirm them. Whether they are plus size or whether they are small in frame, affirm them and let them know that they look good. Because again, these eating disorders to the very extreme, like anorexia, they starve themselves to death. They starve themselves to death to the point whereby they are only skin and bones. And bulimia, like I said, is when they eat, and then when they are by themselves, they induce vomiting because they feel guilty because of the way they have eaten. Another eating disorder is called binge eating. Binge eating, eating large amount of food very fast, unable to stop yourself from eating, and then later on having feelings of guilt. And like I said, this is very common with teenagers, young girls who are facing identity crisis. Impressionable young girls who are comparing themselves with other people, especially on social media, and they feel they do not look good enough. So they have these deep-rooted issues that has to do, anorexia, bulimia, or binge eating. And it's very important, especially when you find someone who has these eating disorders, always make sure that you look for help. Make sure you look for help, especially for these people, because they need professional help to be able to deal with these issues. Now, there are so many mental illnesses that I cannot exhaust them in just this particular show. I have not even mentioned bipolar, schizophrenia. All these are all forms and types of mental illnesses. So again, like I said, I'm just sharing with you basic counseling skills so that you may be able to identify someone who has a mental health issue or someone who is in need of counseling, and you are able to help them. Now, the greatest challenge that faces people who have mental health issues is what is known as stigma. Stigma is one of the greatest challenges to people accessing professional help. There are people who cannot go to see a psychologist or a psychiatrist or a counselor because of stigma. What is stigma? Stigma is when you don't want the negative social experiences that are attached to mental illness. You don't want to go and seek help because people will say you're mad. People will say, omodo nemogoroki. And that stigma is what causes many people not to seek help. So if you are going to overcome the stigma, you need to first of all understand that being mentally ill does not mean that you are mad. It doesn't mean that you are cursed. No. Having a mental illness basically means that you have a health condition that needs to be addressed. We should stop stigmatizing mental illnesses because there are so many people who are refusing to seek help because of stigma that is associated with mental illness. And we find there are several types of stigmas. We have self-stigma, public stigma, and institutionalized stigma. What's the difference? Self-stigma is self-internalization of shame, self-internalization of blame and hate. You blame yourself, you hate yourself for having a mental illness. Public stigma is, these are perceptions and feelings that others have towards a person with mental illness. So you find in a society or in a village, people talk behind the back. They gossip about so-and-so. So-and-so has lost his mind. So-and-so is cursed. So-and-so. This is stigma. And it is very, very damaging, especially to people who have mental health issues. And then we have institutional stigma. This is discrimination and denial of opportunities to people living with mental illness. So institutional stigma means you cannot get a job in an institution because you have a mental illness. You cannot access education in a college or a school because you have a mental illness. So these stigmas is one of the greatest challenge when it comes to helping people that have mental illnesses. So what are the qualities that you need for you to be an effective counselor? And these qualities, you can learn them whether you've gone to school or not, whether you've been trained or not. These are the qualities you should have in order for you to be able to offer basic counseling skills. Number one, you need to have empathy. What is empathy? Empathy is the ability to understand another person's thoughts and feelings in a situation from their point of view. When you have empathy, you have compassion. If you have empathy, you can be a very good counselor. If you have empathy, you can be a very good counselor because it means you have compassion, you care about other people. The second quality you need to be an effective counselor, you need to be a good listener. That means you need to pay attention and give your speaker or your client undivided attention. Listen to what they're saying. If you're not a good listener, you cannot be a counselor. Counseling has to do with a lot of listening, paying attention to what people are saying, because people want to be heard. When someone is talking to you, they need to know you are listening. They need to know you understand them and you hear them. So you need to be a good listener. Another quality you need to have is this. You need to have patience and be non-judgmental. If you're going to be a counselor, you have to be patient and be non-judgmental. That means you create a safe, comfortable environment in which people will talk to you openly. When people come to you with their issues, they know you will listen to them, you will not judge them. Why? Because you're patient and non-judgmental. Another quality you need to have is what? Be observant, be watchful, be alert. You need to be able to develop effective communication skills. You have to develop effective communication skills if people are going to have to have confidence to come to you with the issues that they are facing. Last but not least, you need to have confidentiality. This means that under normal circumstances, no one outside you should receive the information they share with you. That means when someone comes to you with their issues, they can trust you're not going to tell everybody. You need to have confidentiality. And that's why when you go to a professional counselor or a psychologist, one of the first things you do, you sign a confidentiality form, meaning that you're not going to share that person's information without their consent, so that they can trust you and open their heart to you. Let me go through those qualities again. Qualities of a counselor: have empathy, be a good listener, be patient, non-judgmental, be observant, be watchful, be alert, develop effective communication skills, and last but not least, you should have confidentiality. So, as I come to a close, these are the different kinds of counselors. Just like there are different kinds of doctors. We have neurosurgeon, we have a pediatrician, we have a dentist, we have a clinical doctor. Just like there are different subgroups in the field of medicine, so even in counseling, we have specialized counselors. We have a guidance counselor. This is a professional who works in schools or other educational institutions, providing academic, personal, and career advice to students. They are guidance counselors. In most schools, you find that they have a teacher who is qualified to offer guidance and counseling. Then we have an addiction counselor. This is someone who helps people overcome addiction to substance abuse, an addiction counselor. Then we have a marriage counselor. A marriage counselor helps couples build healthy relationships. And also this includes premarital counseling and postmarital counseling. Then we have trauma counselor, helps people who have experienced and have survived traumatic events, trauma counselor. And then we have a mental health counselor. These are counselors who are able to assess and treat mental and emotional health disorders, relationship issues, and life challenges. So those are the different kinds of counselors. But like I said, you don't have to fit into this category for you to be able to develop the basic counseling skills. If you have a loved one, if you have a friend, a spouse who is going through emotional trauma, physical trauma, financial trauma, you can develop basic counseling skills. You can be, have empathy, develop compassion, be a good listener, be the support system that they need. And also, it's important for you to inform yourself so that you can tell the signs of someone who has a specific mental illness. I have shared with you some of those mental illnesses. I cannot exhaust them, but it is very important for you to get the information so that you can be able to identify a friend or a loved one who has a mental health issues or need counseling help. These are some of the qualifications you need to become a counselor in Kenya. Number one, you need to be certified by the Kenya Counselling and Psychological Association. Number two, you need to get a counseling certificate. You need to go to a college, to a university, and make sure you get the credentials that you need. Another thing, you need to have transcripts of personal therapy, a personal therapy letter, minimum 10 sessions, not older than 2 years from a registered counselor. You need to submit a duly filled in official application form from KCPA and make payment. So again, if you choose to go the route of being a professional counselor, these are some of the things that you need to do. But again, I wanted to share with you those few basic counseling skills so that you can be informed, because knowledge is power. Knowledge is power. So from Dimkestai Online Parish, we want to say thank you for watching. Thank you for tuning in. The reason why we are here is so that, we may share with you information and knowledge to help you in your day-to-day living. So until tomorrow, good night and God bless you.